Hi, all. Thanks so much for joining. Speaking of making healthcare work for you, different perspectives and empowering solutions. I'm Stephanie Fields, joined by my co-host, Dr. Apurv Gupta, and we are talking about our interview with Dr. Mark Scheurer, who is the chief of the Children's and Women's Services at the Medical University of South Carolina Children's Hospital. And I just absolutely love this hospital. I loved Mark. I loved everything he had to say. As I've said many times before, I've been a patient of MUSC, so is my daughter and my husband, so I'm a big fan. But I love, love, love so many of the things that he said. He talked about deconstructing things to get to the innovation. And I thought that that was really just eye-opening, because so many people that we talk about the relationships, which is something that he talked about, collaboration between groups to get to the best answer. But he was the first one that I heard that used the word deconstructing things. And I thought that was so cool, because they did that from everything to thinking about how they were doing rounds, and not just how, but why, and thinking of everything from the patient's perspective. And it reminded me of our interview with Dr. Dalila Lewis, who is the chief of pediatric neurology at MUSC. And it's not surprising, because the changing what's possible tagline that they have really filters down from the top, and everyone that they have embodies that. Just thinking about, well, how can I do this, and why are we doing this, and how can I do it better? And, he said he was talking about the need for change, the technology, and the personal relationships, but not letting technology impede on either of those other things, the personal relationships or, outcomes. Apurv, what struck you?
Yeah, Stephanie, so glad to have your enthusiasm and your personal experience, because it certainly sounds like everything you've experienced is coming deeply from, it's not random. It's coming
No.
deeply from the deliberately from the type of institution that they wanted to build, clearly from the leadership all the way across. We've certainly seen it in Dr. Scheurer. We saw it in Dr. Lewis, and Dr. Scheurer talks about it as something that's being handed to him. Over the last 5 to 7 years, it sounds like they've done a deliberate attempt to try to build a deep culture of innovation and respect, and one that recognizes the importance of the patient at the center. This is something that all of healthcare has been struggling with, trying to figure out how to embody. And here we have an example of an institution that's really going at it and really committed to it. Even when it could hurt the pocketbooks, even decisions that could, delaying, IT decisions, for example, certainly could be very problematic and can cause lots more cost in the long run. But they were able to do it because they recognized that what they needed to do is to work around the technology, figure out what they were really trying to solve for, not let the budgets hold them hostage, be able to expect innovation despite the monies that they were putting into it. And certainly the outcomes seem to be bearing, fruit in terms of them being able to redesign the care that the way that they wanted. So hearing from you, Stephanie, and hearing from Dr. Scheurer, hearing from Dr. Lewis, it certainly feels like a truly tremendous example of a culture of innovation, and one that puts patients first.
It really is. And I think the thing that stuck out to me, just when I think of it, it's like, if there's a will, there's a way. Because like you said, the leadership expected innovation, and then it happened through the deconstruction and really figuring out why they're doing things and what makes a difference to prioritize. And it reminded me, I just thought, well, he said, we didn't have per square foot, we didn't have the budget that other children's hospitals did. But looking at that and being in that building, I can tell you that you would never in a million years feel that way. It is so beautifully thought out. And it reminded me of our other interview with Dr. Larry McAvoy and being a positive pathogen, going to his story about the school in Uganda. It doesn't matter. Resources don't always tell the story or predict the outcome. And so I was
Right.
super in love with this interview. I'm really excited to share the full thing with you. And thank you all for watching. We'll talk to you soon. Bye-bye.
Yeah.